So whenever we're doing a clinical trial like this is a phase 3 registration trial. What does that mean? That means that the company has enough data, they're excited enough about this type of approach that they want to go up head to head against something that's standard of care. And they want to try to beat that standard of care so that the FDA will approve it and it can become something that is considered standard of care, something that we can write a prescription for. Um, so in order to do that, we need to compare it to a standard of care. So what's the standard of care for patients in this scenario? Well, without going into too much detail, people who have been through a bunch of prior therapies, a bunch of hormonal therapy, as you talked about, castration resistant, hormone resistant prostate cancer, there are a lot of options on the table, but fewer than we would like.
Okay.
So one of those options, especially if somebody has previously been treated with a chemotherapy called docetaxel, there's a cousin called cabazitaxel or Cabazi. And so it's standard of care for somebody
Right.
who's been through hormonal therapy, who's been through docetaxel. Cabazitaxel is one of the tools in our tool belt. And so that's one of the standard options. And so when I'm signing a patient up, I might say, Mr. X, my standard of care here is Cabazi. The trial is going to randomize you to either that or the experimental arm, and we have to be okay with either one.